So, Dr. Gauri, it's been now our 13th year with the Tata Memorial Hospital, and I think over the 12 years, MCAN has given about 11 crores and 82 lakhs of rupees. So, tell me, how does the money help the patients, and what is it that we can do better for them?
So once again, thank you, Maheka. And MCAN has become like a buzzword almost. Everyone knows about it, and we don't worry about providing the best care to our patients of head and neck cancer because of the funds that we have. Over the years, we have been using these funds for every aspect of patient care, right from diagnostic investigations to giving them prehabilitation. During surgery, these patients require expensive consumables because they have a lot of complex reconstructions, complex resections. So MCAN funds are used for these consumables. We also use a lot of the MCAN funds for post-operative rehabilitation of patients. Like we use them for voice prosthesis, we use them for so many things. Now, besides this, in the last 1 year, we have started using the MCAN funds for a specialized radiotherapy, which these patients receive after undergoing this surgery. And that is called proton therapy. Now,
Is that something new?
It is new. It is not something that is new in Tata Hospital, but we are being able to use it. The problem with proton therapy is that it's rarely available. It's not available everywhere in the country. We have only 2 centers, and it's extremely expensive. So most of the patients can't afford it, though we don't need proton therapy in every patient. In the patients we need it, it's always nice to be having the finances to help these patients, because that time we feel the need for having that money, so that particular patient receives the best form of therapy that's available globally. And in the future, we were actually looking, and I hadn't discussed this earlier with you, but we have machines that are available. These machines are extremely expensive machines. These machines are used for identifying certain glands in the neck when we do thyroid cancer surgery. Now, if we can identify these glands well, it's called parathyroid autofluorescence machines. If we can identify these glands well, then we are able to save these glands. Now, these are very tiny glands. You can't see them very well. And they have a very important function of maintaining calcium for the patient. And if we cannot find them and save these glands, then these patients have very low calciums, and it's a whole lot of problem. And these patients live long, and then they have a lot of problem managing their calcium levels.
And through this machine, you can detect it.
Yes.
And it's like, can I say for a layman cell, like it's a bad cell and a good cell, and then you can pick up the right cell?
It is not part of the tumor. It is part of the normal structure which is there. But you're right. And we can save that, and this machine actually is something that is globally people use it, but it's so expensive.
But it's not available to
no,
the Tata
not
Memorial. So
right now. We don't
should
have
be
it.
To now,
yes.
In future, once we get the proton therapy standardized for the people who need it, because it's expensive, we should also together come and get this machine for the hospital.
Yes.
And of course, try and save as many more and detect the cancer as soon as possible.
Yeah, that would be wonderful, Maheka. Thank you.
Thank you.
So actually, the patient doesn't ever receive the money by himself. The money comes directly from the MCAN show. The checks get deposited into a MCAN Tata Hospital account.
Correct.
And we then, as and when a patient requires whatever amount of funding, and we've put a protocol on which surgery, which consumable requires how much money, so that we don't waste the money that we get. And that money goes into the patient's account. Now the patient has a Tata Hospital account, new account made, so the patient can't use that money for anything other than services that are provided within the hospital. So it's a very transparent and very standardized method where the money comes in directly to the hospital and goes from the hospital's accounts directly into the patient's fund, and then the patient can avail services within the hospital
for the treatment. So, doctor, as always, this is my plea to everybody, that you'll all know that the monies go direct to the Tata Memorial Hospital. In fact, we give the RTGS account of the Tata Memorial to all our viewers, patients and the donors who have year after year really helped us to raise such huge amounts of money. So this year also, please generously donate to them, and of course be part of our fundraiser which is coming up, and generously donate this Diwali.
Thank you very much. We look forward to the fundraiser.
Thank you so much.
Oh my God, I'm
from here only.
Yeah.
So Gauri, tell us, what challenges do you face when the patients come to you?
So, our patients, actually, a large proportion of our patients come from lower socioeconomic strata.
Correct.
The second thing is they come from all over the country. So when they come here, they come with their bags and baggages with diagnosis of cancer. Often this is in a very advanced stage. The two, three things that, of course, the patients are very worried about the fact that they have developed a cancer. The other thing that worries them all the time is how will they try to find finances to go through this cancer therapy. Cancer therapy is not cheap. Of course, at Tata Memorial Hospital, all treatment is very, very subsidized. But still, there is some overheads that the patients do need to pay. And often they have really nothing when they come here. Now, in spite of that, when patients come to us, we are able to provide them very high quality cancer care. Um, uh, we are able to use expensive consumables, do extensive resections, reconstructions, because of the finances that philanthropists like you and other organizations provide us. So the challenges are many, but we are able to overcome them with the support that we get from Tata Memorial Hospital and from people like you, Maheka, and the MCAN Foundation.
Amazing.
It really helps tremendously.
It's so nice to know that, at least the monies are going direct for a cause, for the treatment, and basically saving a life.
Yes, they do.